Hello, everyone. My name is Lizzie, and I am a health coach and program manager for Corporate Health Partners. And today, for our healthy break, we're going to be talking about dietary supplements. So, a couple things, kind of our goals for this presentation today. We want you by the end of this presentation to be able to kind of provide 3 requirements that really define what a dietary supplement is, describe 2 ways that they differ from like prescription medication or over the counter medication. We want you to list 3 things to really ensure dietary supplementation and taking it safely, and then 3 types of supplements and kind of their main uses. So, really, what is a dietary supplement? We probably hear that term all the time, but what does that mean? So, it's a product that kind of falls within these kind of 3 definitions. So, number one, it's intended to supplement the diet. Okay, and it means just that. So, you cannot just rely on supplements alone to really make up like all the nutrients you need in a healthy diet. It is meant to go alongside of a healthy, well balanced diet. It's going to contain 1 or more ingredients. So it would be like vitamins, minerals, herbs, amino acids. We'll talk more about that here in a minute. And last thing that's really important to point out is that dietary supplements are not intended to treat or cure an illness or disease. So keep that in mind. So, how are these supplements regulated? Like, who is watching over these and making sure that it's not out there killing someone? In general, keep in mind that the FDA or the Food and Drug Administration's role with a dietary supplement product really actually begins after the product enters the marketplace. Okay, and here's kind of what that looks like. So, federal law does have some things in place to help with this, and this is what this means. So, it requires that every supplement does have to be labeled with the term dietary supplement. Okay, so whenever you're looking for some kind of supplement, whatever you're in the market for, do make sure that that is on the outside. That is required. It does not require supplements to be proven safe to the FDA's satisfaction before they are marketed. Okay, so the FDA is not going through and approving all of these before they are put out there for the consumer to purchase. And last thing is, it does not require the manufacturer to really prove that the claim that they are making on the product is truthful. Right. So maybe later it is going to maybe be something that's not quite as truthful, and they could come back and say, like, you're not allowed to sell it like that. But initially, it's not going to really live up to the FDA's satisfaction of, is this a truthful claim? And we'll talk more about like what's allowed and what's not allowed with claims here in a second. So once a dietary supplement is on the market, the FDA does have certain safety kind of protocol in place, which is a good thing. Any kind of adverse events that happen when someone takes a supplement does have to be reported to them by like the consumers themselves or like a healthcare professional. So if a healthcare professional says, hey, I had this patient, they had a really bad side effect to taking such and such supplement, the manufacturer does need to report it to the FDA. Last thing, it is not legal to market a product, a dietary supplement product, as a treatment or cure for a specific disease or to alleviate symptoms of a disease. Okay, I just want to keep making that very clear. Anytime if you see a supplement that says it on there, it's probably one that you do not want to buy. These are not intended to cure something. Again, we're going to make that pretty clear again when we get to a chart that explains what's the difference between a prescription medication versus a supplement. So, what are acceptable versus unacceptable claims that can be made? So, supplements are really only allowed to make like structural or functional claims. So, for example, that could look like, this helps maintain such and such function. This helps promote healthy cholesterol. This helps support regularity, right? Like going to the bathroom, or supports the immune system. Unacceptable claims would be something like, this supplement protects against heart disease. It lowers your cholesterol, right? So anything that's making that definite claim that is going to do something specific, remember, really working towards like a disease or an issue or condition, that's unacceptable claims for them to make. The FDA does have to be notified of the claim within 30 days of use. And under a specific law, DHSEA, these claims are required to contain like scientific merit, right? So they can't just be like throwing claims out without there being some kind of science to back it up. A couple other regulation differences between like prescription medications and dietary supplements. So again, we mentioned this before, but keep in mind that dietary supplements are actually regulated like food, which is why the Food and Drug Administration is really looking after them. And again, they consider them safe until they are proven unsafe. That's going to be totally different than like a prescription or over-the-counter medications. The FDA considers a drug to be more unsafe until they're proven safe through like clinical trials, right? So a drug goes through a series of trials and using like humans and animals to really prove that the drug is safe first before they're putting it out on the market. And that's different than the supplements. Also, right, prescription medications and over-the-counter medications are intended to diagnose, treat, or prevent disease, right? So think about if you take a blood pressure medication, cholesterol lowering medication, you're on medication if you have diabetes, those intended purpose is to really help lower those, treat those, really contain your condition that you're dealing with. And again, keep in mind, dietary supplements are not for that. So kind of what are the typical uses of dietary supplements? And this is just through some more recent research and looking at where are people mostly, or why are people mostly wanting to use dietary supplements? So one would be, of course, probably the biggest one would be 45% is a desire to improve health. Maybe someone has a concern that they have like high cholesterol or high levels of stress, or they're dealing with something going on with their health. They want to see, is there something that can really help maybe prevent some of these issues that I'm seeing, or something that can just really maybe boost my good health already and keep me healthy. 33% want to maintain their health, right? So just kind of what we talked about there, except maybe wanting to, now that I've gotten to this certain level of where I'm healthy, what can I do to really maintain that and keep my body working properly? And then 25% is to really help promote bone health, which we are going to talk about more when we get to specific types of supplements. So before starting to take a supplement, there are questions that you should be asking yourself, okay? And definitely on top of asking yourself is going to be asking like a pharmacist or your doctor. We'll get to that in a minute. But ask yourself a couple questions. What are the potential health benefits of taking a supplement? What am I really going to get out of this? Does the product have any safety risks? Okay, so kind of weighing, is this going to benefit me or is it going to cause more harm than good? And that's something you want to think about with a supplement. One of the biggest things is, what is the proper dose to take? Okay, so many of us, especially in the world that we live in, think that bigger is better, more is better. More means I'm healthier, which is definitely not always the case with taking a supplement. So we just want to make sure that we're always following the guidelines, the recommended dosages, to make sure that we're not going over the top and maybe causing some adverse effects when we do take too much of something. So what to look for on the label? Okay, so each of these supplements are going to have a label on them, or they should. If they do not, that's not one that you want to buy. Okay, they should have a label on them. Again, we mentioned before, one of the laws does require that they say dietary supplement, calcium supplement, vitamin D supplement, whatever they're specifically for, somewhere on the label. Okay, so look for that. It should have a dietary supplement facts panel. Okay, so on the back of it, just like a food, any kind of food product would have, it should have an ingredient list and the what it's providing by recommended dosage. Okay, so take a look at that. Last thing you can look for is quality indicators. So that would be like the USP mark that you see in the picture. Again, that's just going to be, it's an independent company or party that really is giving it that kind of seal of approval on having like a higher quality assurance on it. So you can look for that as well. So kind of, we mentioned this a couple slides back, but do always make sure that you're talking to your pharmacist and doctor before starting or stopping a dietary supplement. Okay, this is important for a couple of reasons. Number one, if the supplement has an ingredient in it that is going to interact with a medication that you are already taking, that could be a problem. Okay, so some of these supplements interact with, our cholesterol medications we're on, our blood pressure medications, and what it does is it makes them less effective. Okay, so we definitely don't want that to happen. Make sure that you're asking your pharmacist or doctor questions about it if you're thinking about taking a supplement. Another thing is it could contain multiple ingredients that we don't know what they are. Okay, so it's really important to, if you have questions, you're like, I don't really know what this ingredient is on this supplement list, ask them, what is this? What's it going to do in my body? What's the purpose of it being kind of in the ingredient list? And this kind of goes along with the first one, but dietary supplements, again, interact with prescription and over the counter medications. So if you're taking something like ibuprofen on a daily basis, then you're going to want to know if that's going to interact with a supplement that you're considering to take. If you do, we hope not, but if you do have any side effects or someone you know does, there is a contact information where you can reach out and let them know about an adverse event. Do make sure you are reporting that. If you're taking a supplement and you have a reaction, it's important, again, we mentioned for the FDA to know about that so we can have better control over what's being put on the shelves. So in general, I get this question a lot, like, are they safe to take? And the general answer is yes. Okay, so again, just making sure that you're taking them in moderation, not going crazy, and careful monitoring, doing your research. I have some great resources that I'll share at the end of the presentation. If you're interested in learning more and looking up from reliable sources, what are these different supplements? That's always important. Keep in mind that despite having some practices in place and some laws in place, there have been supplements that have been found to contain like contaminants, impurities, harmful ingredients. This can be both intentional and unintentional contamination that can occur. There was some research out there that found that 20% of all cases of liver damage in the US were from dietary supplements. This was back from 2004. It was saying it was up from 7%. Okay, so again, just another good reason to kind of prove to you, make sure you're looking into these things and asking questions. So let's jump into some of the common ones. And again, we are not going to go over all of them because there are so many, but these are kind of the main ones that we really are asked about in coaching or hear about from our participants. So we wanted to really highlight some of these and give you some information on them. The first one we're going to talk about is multivitamins. Keep in mind, vitamins are nutrients that our body needs. Okay, and this means too that our body cannot make those. Our body does make some chemicals and nutrients that we need, but vitamins are one of those that we do have to obtain it from, like the food we eat or a supplement. This is going to be mainly true by someone who is like maybe cutting out food groups, if you're following a specific diet, if you're not eating enough fruits and vegetables, which is really where we get lots of those great nutrients for our body. And keep in mind too, that we can't just take a multivitamin and think like, oh, well, I'm taking a multivitamin, I don't need to eat fruits and vegetables or whole grains or lean protein, right? We do need to make sure that these are, again, supplementing a healthy, well-rounded, balanced diet. And keep in mind too that another really great thing about food, right? Who doesn't love food? But food provides us with like calories, and those calories are equal to energy that continues to fuel our body, just like a car, right? So we need those calories and we need that energy to do our daily activities, whereas vitamins and supplements don't provide that level of energy that our body needs. If you're taking like a gummy form of a multivitamin or a gummy form of kind of any vitamin, it's going to provide a very minimal amount of calories and carbohydrates, but not enough definitely that our body needs. Another big one is omega-3 fatty acids. This could be like a fish oil supplement if you've heard of that before. And all these are healthy oils, which create EPA and DHA. Again, these are just healthy fats that our body uses for lots of different things. So they are thought to aid in arthritis, if you have issues with like your gastrointestinal system and other like inflammatory body conditions. If you're having like arthritis, that's going to be an inflammation sort of situation. It may also be beneficial for like high cholesterol, triglycerides, and blood clotting issues. Again, keep in mind that they're doing research on all of this. So the may means the research is still out. They're still studying it to figure out exactly how beneficial is it. You can see lots of other things that can be used for increasing serotonin levels, which are like those happy hormones that we have that we release in our body. And kind of going along with that, it may reduce symptoms of like depression and anxiety as well. Common supplementation dose for this is 500 to 1,000 milligrams per day. Again, this is going to vary by the type that you buy, the brand that you buy. Do make sure you're looking at the back of the label and seeing what the recommended dosage is. I do always tell people when they're taking like an omega-3, maybe start with like, if recommends 2 tablets, start with 1, only because there have been some kind of feedback on burping and upset stomach if you start too quickly with these, or if you're not eating it with food, you may have some of these symptoms as well. One other thing to keep in mind with this is kind of that dosage recommendation is similar to the dietary recommendation of having 2 servings of fatty fish per week. Okay, so the main one we think of is like salmon, and that's going to give you the same amount of benefits and probably more benefits by eating it than taking the supplement itself. So just food for thought. Coenzyme Q10 or CoQ10 is the next one. So this is an antioxidant that's actually naturally found in the heart muscle, but as we age, those levels do decline. And also, if you are on a cholesterol lowering like medication, that can deplete the CoQ10 levels in the body as well. So they think it may be beneficial in treatment for like heart arrhythmias or issues with like the rhythm of your heart if you have something going on, high cholesterol, chest pain. They think it may lower blood pressure slightly as well. Recommendations on this are 60 to 100 milligrams per day for anyone older, 40 years and older, and also those taking like a statin medication, and that's going to be like your cholesterol lowering medications. Turmeric or curcumin, excuse me. So this is a spice that is commonly used in like Asian culture. So you may commonly think of it as like the main ingredient in curry if you've had curry before. It may be beneficial for inflammation, pain, swelling. They think it may also be linked to helping with depression and also lowering your triglycerides. So if you're someone who knows that you have issues with that, this may be helpful. We do want to, again, stick to the recommended dosage, do your research on taking this, ask your doctor those questions. There are some interactions with this one, but recommended dosage is 500 to 2,000 milligrams per day. They sell them in like tablet form, so you can take like a tablet of it instead of having to. We don't want you to eat straight turmeric. That probably wouldn't feel great. Also, make sure it's recommended to take it with food to avoid like heartburn or any other kind of like discomfort you may be experiencing. Calcium. Okay, this is a big one, right? And it's a big one because calcium is so important in our body. So 99% of your body's supply of calcium is in your bones. So you can imagine why getting the optimal amount is really important for like bone health. Calcium also plays a big role in like heart health and muscle function. So lots of good reasons to make sure we're getting plenty of calcium. A couple food sources. So of course, I'm always going to recommend that you try and get these supplements or these nutrients from food sources first before you take like a supplement. So like milk, yogurt, green leafy vegetables. A lot of our like cereals are also fortified with calcium as well. If you eat 3 servings of these food sources a day, you meet the recommended amount for calcium. Okay, so again, just food for thought. Keep that in mind. If you are looking for a supplement, elemental calcium is key when you're really looking for this because it's what the body absorbs for bone growth. So there's a couple different types that are sold. Calcium carbonate is going to be one. It has 40% or it's 40% elemental calcium. Calcium citrate is the other common one, and it's 21% elemental calcium. This one does have interactions, okay? And it interacts with actually quite a few prescription medications. If you're taking certain blood pressure, thyroid medication, or thyroid hormones, if you're on certain antibiotics, there's a couple other ones. Those are not the only ones that it interacts with. So again, make sure you're asking those questions, asking your doctor about it before you just start taking calcium. You may need to just spread it out so you're not taking it like the same time as your other medication. So with meals or between meals to really help kind of avoid that interaction. There are a few side effects, but there are some that have been reported, including like gas, constipation, bloating. Sometimes you just have to kind of find the right one for you, the right brand for you, the right dosage for you to maybe avoid some of those side effects. There's still research going on with this, but there has been some signs that show a link between long-term calcium supplementation and increased risk of heart disease. So again, just making sure you're paying attention to that. We definitely don't want to increase our risk of heart disease when we're trying to take something to kind of do the opposite. So intake recommendation, and this is not for supplements, this is for general calcium, like if we're eating it with food, what is the recommendation for intake per day? It's 1,000. That should be 1,200, not 12,000. Sorry about that. 1,000 to 1,200 milligrams per day. Keep in mind, more is not better in this case. Okay, so excess calcium does not provide extra bone protection. Okay, this is definitely one of those where like we don't want to go overboard. Keep it within that recommended amount so we don't do anything too crazy. Vitamin D is the next one. Okay, so vitamin D also, just like calcium, benefits bone health, but it also helps with the immune system. Vitamin D aids in the absorption of calcium. So a lot of times they're taken together if you're on a calcium supplement. Sometimes even the calcium supplements have like vitamin D added to them. Food sources for vitamin D are limited, but like fatty fish and fish liver oils, also like sunshine, are where you're going to get your vitamin D. This one's really important. It's a fat soluble vitamin. And what that means is vitamins A, D, E, and K are all fat soluble. We definitely want to make sure we're being careful with those. Unlike the other vitamins and minerals, these accumulate in the body because they're fat soluble. And we don't want to do too much of them because they can build up and cause some toxic effects. So before you start taking vitamin D, there is a very simple blood test that can be done at your doctor's office and really let you know whether or not a supplementation would be beneficial. So next time you're at your doctor's or setting up an appointment, maybe ask them if they can run a vitamin D level on you if you're curious. Keep in mind that this one does interact with some cholesterol and heart medication, so make sure you're taking a look at that or asking your doctor or pharmacist. Recommended dosage on this is 800 to 3,000 IU or international units per day. Cinnamon is the next one. Okay, so there's not enough research on cinnamon, but they have some. They think it may be beneficial for a couple things. Number one would be like diabetes and lowering blood sugar. Kind of to go along with that, when you have diabetes, a lot of times you're at higher risk of heart disease. So this one could also help lower cholesterol in those with diabetes. They think it may also play a role in heart disease, Alzheimer's, infection, and allergies. Again, keep in mind, research is still out. They think it may play a role. They're not totally sure. So kind of what I would recommend is adding like your cinnamon to, if you have oatmeal, you can add it to your coffee before brewing it in the morning, baked goods, smoothies, right? There's lots of ways you can just incorporate like cinnamon you would buy in the spice aisle rather than taking it in pill form. There is no set dosage. There's no like recommended amounts. They have seen in some studies, they use like 1 to 6 grams per day. And that's kind of what they saw benefits with. But again, that's not like a recommended dose by any means. There's just not enough science behind it yet. This one definitely has, if you take too much, it is toxic. So do not go crazy with your cinnamon. Don't start taking high doses of this. If you're sprinkling it on your oatmeal, in your coffee, those sorts of things, it's definitely, you're not going to get a toxic amount, but it's only when you're taking like those pill forms of it that you could get a little too crazy. Melatonin, this is one I get asked about a lot because it is involved in sleep. Okay, so this is one that we actually naturally make in our body. There's a gland in our brain called the pineal gland that naturally makes melatonin, and it helps us with our sleep-wake cycle, our circadian rhythm. If you've heard those terms before, that's what it's involved in. It does work quickly. So you take it once a night, 30 minutes before bedtime. It works kind of within that time period to help you go to sleep. Reports say it helps people fall asleep faster, keeps them asleep longer. There is some concern with dependency when you start taking melatonin. So they're wondering if you'll ever be able to have like a normal sleep cycle once you start taking it. So just be aware of that and be cautious of, are there other things I can do to maybe improve my sleep habits, my sleep hygiene before I start taking like a melatonin supplement? All right, next one is glucosamine. So glucosamine is really the building block of like connective tissue and the components of joints. So if we think about like the cartilage that's in between our joints, right? We definitely need some padding in between there so our joints or our bones aren't like hitting each other. And that's kind of where this falls into place. And it's a really important role in keeping our joints nice and healthy. Most of the research they've done has been with glucosamine sulfate. They think it may provide relief from like osteoarthritis, knee and joint pain. There is a couple concerns with this. It is derived, not all of them, but there are some that are derived from shellfish. So if you are allergic to shellfish, there's slight concern that you may have an allergic reaction if you're taking that form. They also think it may worsen asthma or raise your eye pressure. So if you have issues with like glaucoma, again, take it easy, ask questions before you start taking it. Recommended dosage on this is 1,500 milligrams a day. Probiotics. Okay, so probiotics have gotten a ton of attention more recently, and actually for some good reason. So what are they? So they are live, active microorganisms that are ingested to really help boost our gastrointestinal flora. Okay, so we know that we already have some good flora going on in our intestines, right? And we want them there because they are what help kind of keep everything running nice and smooth in our body. But what happens is poor eating habits and the use of like some corticosteroids and antibiotics can really disturb our healthy bacteria balance. And that's what we don't want. Okay, because when we disturb that healthy balance that we have, it can affect our GI system, the way that we are breaking down food, our immune function, lots of other things. Okay, so probiotics, when we take those, can really help inhibit that growth of the harmful bacteria and infections that lead to a lot of those problems. When you're looking to buy probiotics, lean towards purchasing the live ones, which need to be kept in the refrigerator. Those are going to be the ones that are a little bit more beneficial. And they usually recommend consuming it on an empty stomach. You can see in the picture, there's 3 main types of these probiotics. So just look for those and you will find them. It is recommended you try 3 to 5 million CFU, colony forming units is what that stands for to start. You just want to go slowly with probiotics and build. There can be some GI discomfort if you go too crazy too fast with these, so just be mindful of that. Last couple of things before we wrap up. There's some things I just want you to keep in mind as we talk about supplements. We talked about how, yes, in general, supplements are safe. And I just like to re-emphasize that scientists are still just now really looking into more of like the science behind dietary supplements, but there's still a lot they don't know. Okay, so you heard me say on all of these slides, it may benefit this, it may do this, right? And this is kind of why, is there's still a lot they're really looking into. So you can see this list of questions that they're still wanting to kind of further research. What dose is unsafe? Like, what's the top limit? Some of these we know that answer to of like, when does this dosage become unsafe for someone? But we don't know that for everything yet. And how does it affect pregnancy, right? Is there something that can be transferred from a mother to an infant? Does an active ingredient in a supplement help some cells and really benefit some cells, but harm other ones? Okay, so just like to sprinkle that in there. Again, just to make you an informed consumer when you're going to buy supplements and someone who is informed when they're asking questions to their doctor. What do I need to be concerned about? Are there side effects? That sort of thing. If you want more information, I have provided 3 kind of main resources that are my go-tos if someone asks me about a supplement that I've never heard about before, or they want some more specific information about it. I like to use these because they are verified sources. They come from science-backed research, which is what we always want to look for. So again, the US Food and Drug Administration, the National Institutes of Health has an entire office on dietary supplements, so that's a great resource as well. And then, of course, the Center for Disease Control. Each of these provides kind of a library of different supplements. It's going to include a lot of them, unless it's something brand new, and then maybe they're going to add it as soon as they hear about it. But it gives you kind of the pros and cons, some of the research behind it for you to look into to make sure, again, that you're just an informed consumer. Thank you all so much for joining our healthy break today on dietary supplements. If you have additional questions, please feel free to reach out to your health coach. We have lots of information and handouts that we can provide you, additional resources as well if you have more questions about this. And that kind of wraps it up for today. Thank you so much. Hope you have a great rest of your day.